Hey agents, Luis Moreno here with Think Medicare, Think ACA. Got some bad news for you guys. Aetna CVS is pulling out of the ACA market. They're out. I guess they're not making money. That's usually what it boils down to. So I'm going to be talking about a few things of when they're pulling out, what you need to be doing with your clients right now, how to prepare and get ready for what's going to happen. Before I do that, guys, please make sure you like this video. Hey, give me a thumbs up. Sharing this kind of stuff with other agents is the only way that I'm going to grow this channel. So thumbs up, give me a comment down below. I'm the only one who checks them. And also, if you would, if you're a subscriber, thank you. If you're not, come on, hit that little subscribe button. Help me out, guys. All right, so Aetna CVS, yes, they are pulling out. They are in 17 states with over 1 million subscribers. Yeah. So it's a lot of people that are going to be affected by them pulling out of the market. Now, for 2025, you are fine. Nothing you need to do with these clients other than a few things. This is going to go into effect in 2026. So here's what you need to do. Okay. So at least let me tell you what I'm going to do, and then you can decide whether my plan works for you. So what I'm going to be doing is inside of my CRM that I utilize, as I am going to create a workflow. This is what I have done. So when I sell any client ACA, depending on the carrier, I give them a tag. Aetna, Oscar, Ambetter, United, whatever it may be. So my CRM already has these contacts inside of it. Now the contacts are already inside the CRM, and they already have this tag that says Aetna. So I'm going to look for, or I'm going to create a smart list. And I'm just going to say, hey, find me all the people that have Aetna ACA. I get my list. I have over 800 people with Aetna CVS that I'm going to have to move over. So I'm going to send them a email, a newsletter, letting them know that they are pulling out of the market, that they do not need to worry for 2025. They do not need to make any changes right now. But here is what we're going to be doing. So come October, this is a month before the market opens for open enrollment. What I'm going to do with these people is we're going to let them know that we would like to update their applications. Secondly, in updating that application, I want to get a list of their doctors and a list of their medications. So all you got to do, guys, get back into Health Sherpa or whatever quoting system you're using and do a search for some alternative plans. Now, open enrollment starts November the 1st. Usually we have a couple of days before to do some window shopping. So I'm probably going to spend the first week or 2 weeks getting with all these Aetna enrollees and doing my work to move them over to a new carrier. I'm going to use their doctors and their medications and plug them into the software and try to find another plan that will accommodate their docs and their meds. Now, this is not all bad news, guys. Yes, it creates a ton of work. It creates a ton of churning. Now, remember, we're moving from this plan to this plan. I'm not making any more money. I'm literally making the same amount of money, but now I've got to move over 800 clients. But here's my positive twist on this. Okay. When I move them to this new carrier, they are considered new clients. Hopefully, it's a carrier that offers a bonus. Now I got an opportunity while they're over here to get a bonus with this new carrier. That's my positive twist on this. Now, trying to think here of what you need to be doing. What I'm doing right now is I'm in a hiring process. I'm in a hiring time frame. I'm trying to hire people now so that when October comes around, they're trained and they're ready to go. So I'm in the process of bringing in somebody else to help me with these 800 people. And if you're wondering what 800 people mean, that's about $20,000 a month. Okay, hire somebody for $2,000 or $3,000 to handle this stuff. I'm still good. But that's going to be their primary focus, is to move them over from Aetna into some new carriers. Now, within the Aetna sphere of products, This decision to get out of the market or to get out of the game has nothing to do with their Medicare. Aetna Medicare is still going to hum along. Aetna Group Insurance is still going to hum along. The Aetna Medicare supplements, no issues. This is only affecting Aetna ACA, Aetna CVS, 17 states with about 1 million subscribers. So I'm giving you some information so that you can prepare, start hiring. If you have a big Aetna book and you're going to be handling it yourself, well, you're going to miss out on a ton of time to enroll. So I highly suggest you either hire somebody who is definitely licensed, hire somebody who can utilize, because of their license and certification, they can get their own Sherpa account underneath yours, and they can manage this transition from Aetna to new carriers. Bad news, guys. Nobody likes it. I don't like it. But what can we do? Now, because Aetna's pulling out, maybe we might have a new carrier coming in, but I've got no news on it. All right. So, guys, get on it. Make sure that you're prepared for this Aetna CVS exit out of the marketplace. Guys, this is Luis Moreno with Think Medicare, Think ACA. Don't forget, if you click on the more down below, guys, number one, what I have for y'all is a lot of the tools that I utilize to build a power agency. I have the Agent CRM affiliate link, the link that I use, the program that I use to manage my entire P&C agency and my health agency. I use it to even manage my agent recruiting. If you don't have a CRM, think about using Agent CRM. I've also got my ACA 101 course. I've got my ACA, my Medicare Smart Books. And if you're wondering, Luis, how in the heck are you writing so much business? Some of it is organic. We've got a lot of circles of influence out there. But the one thing that we do a lot of marketing, social media advertising. And if you don't know how to do that, Shauna can help you. She's got a course, guys, that she sells. Okay, the link is down below. Okay, it's not cheap, but guys, she's got this course is very well put together. I add to that course by teaching you how I utilize Agent CRM with these leads so that you can maximize your closes. Okay, maximize the contact ratio so that you can close. So if you're wanting to get into the game and you want to advertise on social media, get her course. All right, guys, Luis Moreno, Think Medicare, Think ACA. Thank you. And please don't forget to subscribe.